Well, since the beginning of 2020, the novel coronavirus has dominated headlines, and we've learned more about epidemiology and viruses than ever before. As concerned citizens, what should we be learning more to keep us informed without getting paranoid? To tell us how we can stay ahead of the curve for the virus, please welcome Dr. Sudha Rao, founder Dhitiomics, and Anu Acharya, CEO My Genome. Dr. Rao has over 2 decades of experience as a researcher and entrepreneur, having co-founded one of India's oldest genomics firm, Genotypic Technologies, in the late 90s. She successfully pioneered genomics as a service in India with the motto Genomics Simplified, and it is indeed creditable to her that she had the foresight to leverage software as a service model to support rapid growth, and her most recent venture, Dhitiomics Technologies, provides molecular diagnostic services, leveraging some of the most experienced researchers and experts in the field of genomics, healthcare, and technology. Anu Acharya, on the other hand, is a serial entrepreneur, a columnist, a poet, and a charismatic speaker. And as the founder and CEO of My Genome, she introduced the concept of personal genomics in India with the launch of Genome Patri in 2013. She co-founded and pioneered her first venture, Osimum Biosolutions, from 2000 to 2013 through innovative bioinformatics and LIMS solutions, global acquisitions, awards, and fundraisers. Let's deep dive into the world of genomes and viruses with Anu and Dr. Rao.
Thank you, Rini. Wonderful to have you introduce us. I've been your fan since your news days. Lovely to meet you, Anu.
Good to meet you too. Thank you, Rini, and thank you, Sudha. And I'm looking forward to our conversation today. So shall we get started? And maybe, I was actually quite curious. I never really figured out the name Dhitiomics and where it came from and what sparked that for you.
I think this story began with, so Genotypic, the first company that I started with Raja in '98, was essentially catering to research scientists, right, looking at various things, cellular DNA, RNA. And I think one of the critical things was driving insights, right? So Diti means insight. And taking this to real world applications in clinic for a rare disease diagnosis. I think this journey also took us over to, I think something that troubled the entire world, SARS-CoV-2 sequencing, right? So without knowing the genome of this notorious virus, I don't think we would have had vaccines. We wouldn't have had tracking, known that Omicron came from South Africa, right? So I think that's where it all began.
Wonderful.
And you have, I think you sort of were one of the first to bring this up as testing in airports. What was the thought process there, and how has it sort of evolved, and how did it really help as somebody in a corporate world offering this for the first time?
Sure. So I think, I think most of us, when we started off in the early 2000s, we were working with academics, with pharma companies and others. And then we started My Genome in 2013. Clearly, RT-PCR and all that were things that we did in the lab anyway, right? From the last, from 2004-5 onwards, it was something that was always there in our labs. So when COVID really came on, what we thought was that maybe this is the time we could help out. We could help out the government in terms of, being able to look at, curbing some of that by doing some of the testing. So we started off mainly with testing the corporates who were keeping their shops open at that time, right? Because a lot of the IT companies actually had shut down. So we started off with doing testing for the corporates. And very soon, I think we also had started doing testing for regular people who were walking in. And of course, we had no idea that, at one point, because we are used to people shipping their samples in, we were doing everything was done offline. We were not used to having too many people walk into our centers for the last 6-7 years, because everything was mail order. And now suddenly we had people walking into our centers. But one of the things we thought of early on was that if we were to control the virus, then one of the first things we need to do is to be able to do that at the ports. And airports were the first obvious choice. And at that time, when we approached the Hyderabad airport authorities, they had thought about it, but not really implemented it. So we were one of the earliest to reach out to them, and then they put out. They looked at all the other options, and then finally, I think they asked us to become the vendor at Hyderabad airport. Now that was an interesting time, because at that point there were barely any samples, right? The government was controlling who we should be testing and all of that. Over a period of time, of course, that changed quite dramatically, and we started to see that airports became something that everybody wanted to now be at, because it was like a nice, good business. But for me personally, I think the thought was primarily to say that this would be one place where we need to control the virus. It's where the new mutations are going to come from, and if we don't curb it there, then it will. So that was the thought behind it.
I've also been amazed at how informed the common man has been on this pandemic. RT-PCR has become buzzword everywhere, right? Be it homes or schools, or children know about mutants and even the concept of mutations. Specifically with Omicron, I think the fact that this was one of the variants that had the most number of mutations compared to the earlier ones, your Alpha, Beta, Delta, which really devastated India, right, in 21 April to June. And there is a lot of curiosity or anticipation in the negative sense on what could new variants mean, right? So, and I think somebody asked me, sometime late November, and I was trying to be an optimist. I said, I think we're done with it. We've gone through the worst, and we've probably reached herd immunity. Most of the population is exposed, and will we get new ones? And here comes Omicron from South Africa, right? So, in terms of what can we expect, and what is it that is different with this? So I don't know how many of the audience know that Omicron itself has many subtypes. There is all these alphabets and numbers that give names to these variants. There's B1, there's B2, there's B3. How are they different? Yeah, they all have many changes to their genomes. But I think what the virus is trying to do very cleverly is, how do I evade this stupid human's immunity and make a nice place for myself and live for perpetuity? I think viruses don't live outside of us. So what do you think? I mean, we've all done these predictions. There've been all kinds of mathematical models. There's been data on the ground. We've had our own experiences, over the last 2 years with our testing and sequencing. Of course, apart from the economic impact, where do you see I think we recently saw a communication from the Ministry of Health that it's almost like a declaration that the pandemic is over. Just yesterday, we received this notification. So how do you see this? Where do you see, like, say, 6 months down the line, do you think COVID will still be in people's mind, or, we're done with it and we move on with life?
So I think it depends. I think it depends on the segment of the population you're talking about. I mean, people like me always wear a mask. I've been wearing one for the last 2 years, and I think I will continue that, right? I mean, even if someone declares it's over, I think for precaution's sake, I think I will still do that. But there will always be the set of people who just won't do that, right? I mean, and it's similar to, in many cases, when I look at it from a personal genomics point of view also, right? There is habit change. And I think for a large majority of the people, I think a lot of habit changes have happened very quickly thanks to the pandemic. But there is always going to be that set of people who would say that, no, but this other person wore a mask and did everything right and still got COVID and still got long COVID and still they got all the, so they will pick on the negative things, right? So I think there is always going to be that segment of population who will not believe data or will believe data in whatever form they will believe it, right? But what has happened, I think, over the last 2 years is a massive change in habit formation, whether it is in terms of how sanitized you are, how your hygiene has become important, you're taking care of, wearing a mask while going out, you're meeting smaller groups and all of that. So I think that is here to stay in many ways. I think the pandemic is far from over. But what has happened is, I think some people have just gotten tired because the normal life has been it seems to be put on brakes, right? And I think people want to let go and want to be able to enjoy some of that. Now, I think for you and me, we've been in the business, we've been coming to work on a regular basis. So we didn't miss a lot of the normal day-to-day interactions with human beings in many ways, right? And I think that has become a problem for a lot of people. But I think the variants are still here. We're still seeing a large number of surges. Countries that were so careful with their COVID, all the restrictions and all. I think Hong Kong and others are now seeing a lot more surges. I think India may be hopefully at a different point of the pandemic, but we can never say, because we are still, I think, ultimately we are a global village. So until it is over everywhere, it's not over in India as well. So I think that's one message that I think we need to bring out to the average person, that the pandemic is far from over. Let's wait till actually either everybody is vaccinated or somehow we figure out how to curtail the transmission of the virus. I think that has become a challenge, right? So I don't know what your thoughts are on that.
Yeah, I think I agree with you, Anu. I think one of the challenges of this pandemic has been the vaccine inequity, and you have these pockets. While one part of the world has been well protected with vaccine, you have it, exploding in others, and as a result, no single community is now protected despite vaccinations, right? So you have these pockets of breeding grounds for new variants to come up. So unless the entire world stays protected, I don't think we can claim that we have achieved protection. But what has also happened definitely with the Omicron is that most populations, I think more than 80%, have had an infection. So in some ways, what vaccines could not do, perhaps a real infection has done. And thankfully, it was not such a devastating variant as the Delta was. So people got away with very minor symptoms. But that's also the other side, which is essentially, I hope people don't become complacent, because assuming that it's like any other cold virus, and then we're ready to face the world, to go back to normalcy as it was before COVID-19. I think I really agree with you on keeping all the practices on. We don't know, today it is coronavirus, and tomorrow it may be something else. I think what the world has become prepared for is even understanding that a pandemic of this nature can happen despite all the advances in the world, and we essentially have to be prepared. We are too populous, we are too many on Earth, and I think we'll have to be prepared for more such pandemics. Yes.
I guess the other part that I think a lot of people are maybe missing out on is that I think one is, of course, there is the virus. It has its mutations, and depending on that, you can think about severity or how contagious the virus is going to be. But there is the other part, right, where different people react differently to the virus also, right? So I think when you look at the host, and you mentioned that viruses really can't live outside of us. But the truth is that I think depending on our genetic makeup, I think we also respond differently to the virus also. And I think that's another thing that people should understand, that even if we saw that in families that were doing that got infected together, there were people who were severely affected and others who were not. In fact, there were some people didn't get infected at all. So it was quite an interesting way when we looked at the data. It seemed quite interesting because we compiled a lot of that data. We were publishing that whole data in terms of saying, are we finding something that is interesting in terms of our immune responses? Right? Are we finding something interesting in terms of infectiousness and all of that? And I think that is another area which I think is also an interesting part for people to understand, that they can also understand their own genetic makeup to be able to see how they would respond to a virus like this.
So very interesting story. I mean, I think I'll have to give my personal example. Me and my husband, I think, as you know, we were running the company all through the pandemic, since the first lockdown until now. And so our colleagues, through wave 1, 2, 3, each one would succumb, to the infection, but somehow we managed to not get it. And we were wondering if it was genetics. It's quite unlikely because my husband and I are genetically not related, right? So, and our son got the infection. So I think there is both environment, one's own precautions one takes, or habits, as one might say, maybe the food one is eating, healthy habits. As you might know, teenager would not be expected to eat healthy food. So, and I think all of these contribute, and that's what has made this pandemic so complex and unpredictable, right? So, of course, I think people have scientifically published data to support that there is perhaps a genetic component that determines how severe the disease will be. But there are also so many other things like how many people in your neighborhood got infected, what was your travel history, how healthy were you, comorbidities, and to build a model that incorporates so many variables has been the challenge. That is why I think we've seen so many different models really falling flat on the predictions and some really good ones. So it's been a learning. We just have to wait and watch.
I guess compared to the previous pandemics, I think, of course, this has been a long extended one, but it has also been a one where I think there's been way more sequencing than we ever did before. Right? And I think you've been involved in doing some of us have been involved in, looking at the data, but some of us have been involved in doing some of the sequencing as well. So I think how important is sequencing on from an epidemiological level. Do you think that we should continue doing the sequencing, and how often and where all should we get the samples from, in your view, to be able to predict this more accurately?
I think one thing is absolutely, yes, sequencing has been extremely powerful in how much information it has given us in terms of handling the pandemic, right? Worldwide, I think there are several million sequences that have been submitted. So 2 or 3 things that we really learned from sequencing is, of course, the first vaccines, the mRNA vaccines, would not have been possible without the genome sequence being available as a first thing. And also being able to trace the origin of mutants, seeing how it is behaving and taking the necessary action. Even with the Omicron, for example, I think they really reported, it was a fantastic work by the South African team, right? So to have actually observed that they're seeing a different kind of, fever or different response to the virus. It is testing positive by RT-PCR, some are not testing positive, but something is looking different. And what was different was sequencing, right? So it showed that this is a new variant, and then alerted the whole world. Of course, there were very knee-jerk reactions in actually stopping travel from that country. And when we know now that those kind of responses really don't help control the pandemic, except that good practices which can delay the rise of infection, so that hospitals, if required, are prepared to take on cases. That was what was wrong with the Delta wave that India faced. We were unprepared, and no measures were taken to or rather minimal measures were taken to prevent it. So I think sequencing has contributed, and we have to continue doing that, even if the incidence is very small. I think Karnataka reported something like 100 cases a day in the recent days, but it's important to look at them and be able to detect any new variant that emerges, so that we're prepared, to contain them as much as we can.
Now, one of the things we found was that, I think since the Omicron times, I think people have become a little complacent. One, they don't test. But two, even if they are found positive, they are a little bit, and they're asymptomatic, then I think they find it difficult to sort of accept that they do have the virus, right? And I think that, when you add with that the complexity of maybe, not allowed to do X and Y and Z things, I think people become even more worried about testing, because it's sort of seen as something, as a taboo, that if you're positive, so all of that, versus when you look at certain other countries like South Korea and Germany and others, I think it became more or less more normalized. And I think in India also, to some extent, I think towards the end they've become a little normalized, but now I think people have become too relaxed, and they think the pandemic is over. And I think that's where we spread it and give it to people who are probably more at risk, like the elderly or people with comorbidities and others, because it is so contagious that you really can't do much about, curtailing it once it's in your household, right?
Yeah.
And I think that's the big challenge, that how do we get people to understand that, testing is not a bad thing. It is something that you should do, not just for yourself, but it is also for the people who might be around you, who might be more at risk than you are. But a lot of people don't seem to be that worried about it. And I think that's the challenge that we are seeing, at least around us.
I think one of the things I noted, Anu, is that between the second and the recent wave, there's been a lot of acceptance and home testing. Right? Yes. People have done a lot of self-testing. So we may not actually be reporting the actual numbers, because that doesn't get reported to the health ministry or whatever. And that's good, and sort of in a way it is empowering people, right, to make decisions and knowing what they have. So I think that's remarkable, that the access to doing self-testing was one of the biggest changes that happened with this pandemic. But as you rightly say, it has also meant that, the stigma, I think, has disappeared to a large extent. Do you agree?
Yes.
Yeah. Yeah.
But I have to tell you one, since you mentioned the home test, I remember recently a friend, I think we were planning to have like 2-3 of us meet for dinner over the weekend. And so she announces to us in the small group that we have that, I'm sorry, but I tested positive. So we said, oh, that's too bad. Then, take care and blah, blah. And then we realized that she had actually just seen the control, which is a line that you will see and said, can you please send someone, because her husband looked at it and tested and was negative, and said, I think she just looked at the control line and called herself positive. So I think we have both of this when it comes to, and this is an educated, obviously, person. And I think that's a challenge, right? Because I think some of these self-testing at home might not be as self-explanatory as we think they are. To us who might be doing this on a more regular basis in the labs. So I thought this was a funny incident that recently happened, and I'm sure it probably happens to a few more people around the globe as well.
Yes.
So I stopped you from you were talking about the home testing and other things, and this just came up.
Yeah. We've sort of helped many people in distress. Looks like my throat is itchy. Do you think you can give me a kit? So we used to have these kits at home, and please come take it, kind of thing. And I think even in our organization, rapid tests were very useful. Although we had the RT-PCR lab, it really helped us manage working at our labs, because only 50% of our personnel could work from home. These were the data analysis and sales team, but lab guys had to come to work. And so some of these things really helped us to, have clean. And in fact, these practices helped so much that all those who actually caught the infection were from home. Nobody got infected from work. So I think one thing with this pandemic was technology, which was even not thought of as accessible, became really commonplace. And very, very quickly, how companies and institutions in India rose to the occasion, came up with these rapid things. Really, I mean, it's mind-boggling. I don't think it was even thought of that we have so much capability and power to do things within such a short time. That, I think, has been a really, really positive thing of this pandemic.
I agree. I think this was a turning point. I remember when H1N1 was there. I remember at that point we also made a RT-PCR kit. And then we were disappointed because I think the pandemic had ended and all of that. So this time we said, we won't make an RT-PCR kit, right? I mean, it's too much time and energy and all of that. But I think what we saw this time was quite different. And what was interesting was that we saw that a lot of the homegrown labs were able to scale up quite significantly. Whether it is a lot of the companies that made kits entirely in India, I think they were able to scale up quite considerably. And also, I think what was great was the lab certification process. I think never in the history of India, I think we had that many labs accredited, all in a short span of like a year or so. Right? And I think that for me, I think was probably one of the biggest achievements in terms of how do we look at quality of labs in the country in general. Right? I think that was probably one huge step that was there. But I often worry whether, what happens after, right? To some of the homegrown manufacturers and others later on in life. Right? What happens? Will that be a capability that we can then leverage off to build better and more products? Can we improve the quality of our products that are made in India? I think that is where we will see the real change in terms of can we compete with the rest of the world in terms of quality and price? And I think I'm hoping we'll get there soon.
Yeah. I think we did, as I know, many of these reagents and kits, I think more than 90% used to be imported. And when this pandemic struck, there was this real need, dire need for local manufacturing, right? And I think that came up in a very big way. I know now people who make nucleotides, who make, all the enzymes that you need, plasticware, name it, and you have somebody doing it. That internal capability that we built is really remarkable. And I'm sure, as you say, we can leverage this for many other things, if not for infectious diseases, even for many other things in clinical diagnostics. It really prepares us for the future.
Yeah, I think they say necessity is the mother of invention. So I think in some ways, I think also maybe the mother of discovery in some form. Because we found out so many players, I think, and DBT and Dr. Renu Sarup and all. I think a lot of these were efforts to tie a lot of that loose ends together. And I think it was fantastic to see a lot of that happening in a very short period of time. So many people were involved, Able got involved in coming up with the list and all of that. So I think it's fascinating to see how quickly things were done when there was just an urgent need for getting it done. So I'm quite happy that happened because I think in some ways some changes are going to be permanent, and that's I think is going to help us move the biotech and our life sciences capabilities of the country.
Yep. Yeah. Another thing was, of course, the vaccination the numbers that we achieved. Although one thing that has been a concern, I think. Which are now being discussed quite a bit across the world, is the thing of long COVID, which beyond your acute phase of the infection and after, right, 3 months, 6 months later, people are reporting many things. I think it's important India starts recording these because for example, vaccinations, I think we've not really captured the adverse effects very well. As much as, even I've known doctors ignoring symptoms of long COVID as, attributing it to something else. But I think it's really serious and it is real. And it will be a significant health burden. And somewhere I think all of us have to wake up to acknowledging that it is real and doing something about it.
I think Meena is here to start asking us questions. But maybe one of the things I wanted to just bring up was that we have been doing COVID testing and taking the sequencing samples for the positive samples and all of that, working with academia, working with governments, and all of that. And what is I think what is interesting is that the use of data, right?
Yeah.
And people still look at data as being something that is forced upon us. But if we can create an environment where that becomes an incentive for people to do, I think we will start seeing better ways of collecting data, both in terms of just the testing, but also in terms of sequencing, if we can get that to happen, right? And I think that's one area where I feel that maybe we've just not been able to create a simplified version of data collection and incentivized way of getting people to submit their data on a regular basis. So I guess
I think I spoke while you were speaking, Anu, and sorry for the interruption. If you're ready, we also have a few questions and comments from the audience. Maybe we can take them as well. Although I hate to interrupt the train of thought that both of you have been sharing, making science so easily understandable for a whole lot of us. So thank you for the session. But if you're ready, maybe we can take a few questions.
Absolutely.
Should I ask?
Yes, please.
Okay, so the first question is, and you can take it in whichever order that you want to take it. The first question is from Anisha Ghosh of SCORE. Nature always finds a way to balance itself. Though the pandemic caused us great suffering, we cannot deny its positive effects on the environment. What's more important, information can help us now to fight whenever we have a bigger pandemic at hand. So do you think we have the systems in place to learn from the information and learn from what we have experienced in the last 2 years? And there's a follow-up question saying, and how can we prevent such a pandemic from arising in the first place?
Sure. So I'll take a first stab and then I'll let Sudha answer. So one, I think yes and no, right? I think we have definitely done some good to the environment, but we've also done a lot of bad to the environment because of the amount of PPEs, the amount of the waste, the bio waste that we accumulated during all the testing and many other things, right? So I think one is that what happens to all of that. So that's another lesson that we need to learn. That yes, we did a great job by stopping the traffic, by reducing the pollution and all of that. But that's coming back on, I think, at least in Hyderabad and Bangalore. So I think definitely, I think that is coming back. But we can learn. We can learn that if we detox the earth for some time, we will be able to see the positive effects of it. The way to manage this in the future is through sequencing and through surveillance, better surveillance, and I think better data collection. Data collection that is easy and open to all, right? So that we are able to then contribute in a more effective way. So even if it is consumers that are contributing to the data, I think they should be doing it without feeling that they're going to be punished for it in any form or way. So I think those would be my two thoughts. Maybe Sudha can add some.
I would have a very philosophical answer to this, Meena, if you would allow that. I think one of the things is we are very populous, right? And so as the audience rightly pointed out, nature finds a way of, normalizing for these imbalances. But having said that, I think most of these infections that we see are zoonotic in origin, which means they jump from animals to humans. And the more we try and avoid such interactions, not as in having pets, but essentially those that are in the wild, those could be some ways that you can potentially prevent pandemics that arise out of zoonotic infections. Apart from, of course, probably not being very densely, packed in cities, which is what we will probably see in the world, and of course, climate change is another thing that's contributing to this. So unless we're able to address all of these problems, I'm not sure it's humanly possible to prevent another pandemic from happening.
Okay. Nishia, sorry, Anu? Okay.
No, not me.
Nishi Agarwal asks, can we execute the learnings from coronavirus pandemic the way we have dealt with for other viral diseases and its management as well? I think she probably refers to the speedy vaccination program and also, the rollout of sort of immediate healthcare camps, etc.
I think for sure. I think we have created infrastructure now that can be easily leverageable to other things. We have now an app. We have, different people who are used to doing, like a lot of the academic institutions also became centers for doing testing and all of that. We found a lot of the point of care devices. We found home testing kits and all. So I think those are easily leveraged for other sort of viral infections. And I think that's what Sudha and I were talking, that I hope this is for the best, that in the future we are able to do that even when supply chains were cut off. So it certainly can be used, I think, because the infrastructure is now there, which we did not have in the past.
So Amita Vadera is asking if, the capability for sequencing, and as you mentioned in your session as well, has really helped us stay ahead of at least the more recent variants of COVID in India and also globally, given that they were, both sequencing and genomics and all these technologies have so far earned a bad name. Do you think that, now people will look at technology in a different light?
I'm not sure I agree with a bad name. I think, none of you would have had vaccines if you did not have sequencing. As I was talking earlier, all of the mRNA vaccines came from knowing the sequence of the viral genome. And definitely, as I referred to earlier in my chat with Anu, that we wouldn't have known of Omicron if sequencing was not there from South Africa. I think it's definitely a very, very positive contributor as a technology to tackle this pandemic.
Anu?
Yeah, I agree, and I think the only maybe the other places is to make sure that the health budget is sufficient enough to be able to do these things whenever required. I think that is one big challenge that I think this time it had to be taken off from multiple different kinds of budgets because it was such a worldwide emergency. But if we are prepared, if we do it as a preventive way of being able to manage this, I think then if you're doing it continuously, I think it becomes a much easier way to be able to control rather than waiting for disasters to happen. But if they do, I think the good thing is we now have the infrastructure and the know-how to be able to do that.
Okay, this one is a slightly tricky question. On the backdrop of the controversy over the origin of coronavirus, how, and the war in Ukraine and Russia, how the world economies are gearing up for the threat of bioweapons using viral and bioweapons. So, yeah, I think that's what she means. This is from Priyanka.
So, can I respond, Anu?
Sure.
Yeah. Biowarfare, I think, is real. And in fact, it sort of showed us the possibility. The COVID-19 pandemic showed that if one were to use biowarfare, what could happen in reality. So, yes, it can be devastating if it is used as a weapon. As to the origins of the virus, we still do not know. Scientifically, we have not been able to establish whether it was lab created or it was a natural, zoonotic transfer from an animal to humans. But I think that's not really so critical, as in just warning all the labs that work on viruses and trying to create vaccines to be a lot more careful than they currently are, because it's a real threat. Meena, what was the second part of the question on the Ukraine?
No. So there's the question was that in the backdrop of the war and the origins, do you think biowarfare is real, and how do you think it's going to be used? But I think you did answer it. So okay, the next question is from Roshan. He's asking this public-private partnership that has been really deployed really well in, say, vaccine creation and also sequencing and rapid testing and provision of healthcare infrastructure. How do you think, given that both of you are practitioners, how do you think we can keep this momentum going? So what would be your advice to government and other stakeholders to sort of make sure that this momentum doesn't go down?
Sure. So, I mean, maybe I can take a quick stab at this. One thing was that it was the first time even for me, Map My Genome, to be able to get involved with, let's say, governments and academia and others. And I thought that was a very fulfilling experience, because we did 2 sero surveys in Karnataka, and while there were certain bureaucratic hurdles along the way, I think it was overall a very good experience for everybody, right? Because we could offer some of the capabilities in terms of the domain knowledge, the testing, some funding, and various other things that government could provide us the right kind of where we can do what, which populations we can look at. The academics could do the actual who will we select and all of that. So I think it was a fantastic experience, and overall I think a win-win for everybody. So in order to make this go forward, I think what we need to do is to build on the trust that we've created over the last few months. I think it has, since the experience has been good and positive, I think we need to build on that. And we can only build on it if we realize that there's value in it. And I think for all of us, I think one of the areas that I know that a lot of us as private companies want to be able to contribute to is in the sequencing part, right? And I think slowly that has also started to happen. Because in the end, I think we all are in it together, and any solution that we create cannot be done by one sector independently of the other, because everybody has their own expertise in it. So I think that's one thing that we need to build on the trust. The second is that I think use that mechanism and the way we have been able to do to make it such that it becomes easier for many people to move back and forth between academia, government, and industry. And maybe that will build a little bit more on what we've built over the last few years. Even if Sudha has more ideas on that.
I think I sort of agree, and extending on that, just
something.
Sorry, am I audible?
Yes.
Yeah. So a lot of platforms have been created, right, which essentially brought the government and the private players together, and those have to continue to exist and be deployed across other need areas. I think that's what I would say.
Seem to have lost Sudha, but I'm sure she will come back on. So while we wait for her to give her comments on the public-private partnership, Anu, can I ask you one last question? And then maybe we can let you both have your last word.
Sure, she's back.
So the question that I want to sort of ask you is asked by Calvin Kamatil. His question is, due to COVID-related reasons, there have been several other, it has helped in reducing several other diseases. So do you think some of the ways that we have dealt with as society, as community, there are advantages that we should sort of continue on? If yes, what practices should we continue to make sure that we stay ahead of this virus and others?
So I think mask wearing actually not just helped us in tackling COVID, but also a lot of the other infectious diseases as well, because I think some of the measures are similar. So that was one. Sanitization was another, right? We are much more cleaner as when we go somewhere, we are sanitizing our hands and so on. So I think some of those have changed, but I think there's been a segment of the population who has become healthier staying at home because they were, they had the time to be able to do that compared to earlier. And I think that is also a great thing that we can probably continue. But there's also been a segment of people who went into doing things like I did in the early part of the pandemic, which was to start hobbies like baking and all, which maybe were not so fruitful in the long run. So I think those are things that maybe make us a little bit more unhealthy. So I think some things, for sure, we need to leverage on that. And we realize that it has a positive effect on our overall health if we are able to use the right mechanisms to be able to protect ourselves. But at the same time, I think one has to be careful that, if they were living in small houses and they did not have access to gyms and they did not have access to just doing regular exercise, I think those are things that maybe we want to change as we move into the next phase.
Yeah, I think apart from the
At My Genome, Anu, what would be, what would be your last word? So if you were to, where do you see the vision for, for our country overall, for sequencing, for the technology, and for Map My Genome in particular?
So I think at Map My Genome, our vision is to be able to enable people to lead healthier lives. So about 100 million people. So I think in some ways, I think some of this catalyst has been done already by what COVID did, because it familiarized a lot of people with what we do. But at the same time, I think what I would like to be able to do is that if we can, one, do the sequencing of every human being, possible, I think it gives us data that maybe we have never ever thought of before. Right? That could be one thing that is a dream of mine, that we could probably be able to get that information, because one of the things we did was to be able to come up with an immunity report for consumers, where we looked at their genome patri and then we said, we'll help you understand how you would react to this virus. So for me, the mission is get as many people as possible to be able to look at this not just as something that you're doing for one virus, but you're doing it because ultimately, I think if you are careful, you'll be able to lead a more healthy life.
Thank you. Sudha, from you?
I think
what's your vision for the technology and for Dhitiomics in particular?
And one of the things that came out of this pandemic is local preparedness and a general state of well-being. What we saw as most mortalities that happened were in comorbid people with comorbidities, right? So learning is, I think I shared that with Anu, is better health for everyone, which is all human beings own their health and their bodies. And with technologies, we should be able to respond quicker to the needs of any such pandemics. Technologies and platforms that we have created. Dhiti has built an excellent platform for sequencing across. We were doing it for rare diseases, and we're now doing it on infectious diseases. So we hope to make this accessible to everyone, affordable, and enable clinical decisions. I think that's what will be our vision for Dhiti.
Well, on that very, very positive and optimistic note, I thank you for your session.